Andre Tinio recently recovered after fighting severe tuberculosis for a year, a diagnosis that impacted his colon, appendix, 2 vertebrae, and his lungs.
I didn't think it would happen to me, and so I want to use my lived experience and my story to educate others.
He's sharing his story to tell people how difficult the disease can be to manage after Primary Care Alberta declared a TB outbreak in Edmonton's inner city, mainly impacting people experiencing homelessness.
To have TB diagnosed in that kind of a situation is really awful because, like I said, the medication is so intrusive. You need to be watched. You need to follow and comply to a lot of the health regimes that they want you to do. But when you're in a position where you have to think about your food, you have to think about your mental health, you have to think, how do I get to appointments? How do I do this? To compound with now living with TB and trying to get rid of that, it exacerbates everything in your life.
Experts say they typically only see a couple TB cases in Alberta per year, but this year there have been 12, with most of them being reactivations of the disease that has been dormant in people's bodies. Doctors suspect that could be because of the steep increase in the homeless population in Edmonton.
Improving some of these socially determinants of housing, ensuring adequate nutrition, adequate housing will be extremely helpful in preventing TB disease in individuals, and will also reduce the risk of spread amongst vulnerable populations.
Primary Care Alberta says it's meeting regularly with inner city agencies to share information, provide support, and carry out assessments and screening for those identified as having close contact. Doctors say the risk to the general public is very low, as they say you have to be exposed to the disease for several days in order to contract it. But Andre hopes people don't stop doing their part.
I think we all have a role to play in public health, so get vaccinated. Go teach others about what could happen if you do get sick. Listen to your body. Follow up with your doctor. If we can take care of ourselves, then we're able to take care of each other.